Hi, I'm Dr. Mark Jagger, creator of the Spine Specialist and Spine Specialist Clinics. This video will tell you a little bit about what to expect during your initial consultation. So the first thing I'd like to let you know is you can relax. We know you're in a lot of pain, so we want to keep this experience as relaxing and comfortable for you as possible. So it's nothing to worry about. We're going to do a few orthopedic tests on you, and the doctor will determine where things are coming from. We'll review any x-rays or MRIs, any other test results that you have that may be pertinent to your case. So we want you to bring those with you. So first, relax. Number two, bring in any x-rays, MRIs, pertinent test results. Number three is you may get a first treatment during your visit. However, it may take some time, depending on the complexity of your case, for the doctor to actually go through all the information and come up with a plan for you. So every case will be a little bit different. Each office will function a little bit different in that way. So what you should first expect is a lot of information that you may not have received from other practitioners, because we want to make sure that you really understand why you're having the pain that you're having and what we can do to improve that. So the key to you understanding is proper explanation, and the key to you getting better is understanding why you have the pain in the first place and understanding what we can do to try to make sure you get back out into a pain-free life. So thank you very much for watching. The next video will show a little bit about what will occur during an initial consultation, if you care to watch that and see what you're going to experience. Thanks so much for watching, and we look forward to helping you live a pain-free life. The purpose of this video is to talk about two components of the visit called the report of findings and treatment plan. So those two are highly interrelated. The report of findings is essentially why you're having the pain you're having and the explanation to you as to why that's occurring. The treatment plan is our plan to help fix that problem. So sometimes those two components will occur on the first visit. In some offices, the doctor may want to take your information and deliberate over it a little bit before he or she comes up with that treatment plan. So, report of findings. During this part of the visit, we are going to talk in detail about why you're having the pain that you're having. So it will take into consideration any test results like MRI, X-ray that you've brought into us or maybe we've sent you for. It will also talk about the detailed performance of orthopedic tests. So these are certain tests that we perform, bending a leg a certain way, bending an arm a certain way, a neck or low back. Things that we do to try to determine exactly where the pain is coming from and how severe it is. So we'll explain in detail the results of those tests. There may be some neurological tests that we do as well. We will explain what happens during those tests as well, and it will help you understand first why we do the test and what we found and why that is significant. You understanding that makes it all make sense to you, and that's very important to us, that it's got to make sense to you. We want you to understand the problem that you're having, the reasons why, better than most doctors that you will see will actually help you understand that. It's important because then you understand how to get better. You'll understand why we're doing what we're doing. So the next part brings us to the treatment plan. The treatment plan is our plan for you on how to help you achieve that pain-free life. We will take a look at all the things we found in the report of findings and the orthopedic testing and neurological testing, and we will come up with a plan as to how we're going to get you better, which will also be explained. Now, the thing about the treatment plan is some of the components will be frequency of treatment, so how many times that you need to come in total, how many times you need to come per week, how much pressure we will use with decompression, what parameters we may use with the laser. All of those things are taken into consideration to develop a very specific treatment plan for your case. So that's another important thing to know. With the spine specialist, there are very many parameters that the doctor can alter and change on the device to be very specific to your problem. So in saying that, throughout your treatment plan, if you find some things work better and some things don't work, you got better on a certain visit, but you've hit a plateau, those things are very important to tell your doctor, because we can change very many things on the machine to actually help you get better faster. And sometimes you'll hit a plateau. It's just like working out. you lift a certain amount of weight and you get to a point where you're comfortable lifting that weight. Well, there may be something extra that you need to do to achieve greater amounts of fitness. Healing is exactly the same way. And that makes a lot of sense because the body healing, it does the same healing as it does building. It takes time and different stimulus to make different changes in the body. So feedback to your doctor is very, very important. The other thing to remember is treatment on the spine specialist is incredibly comfortable. It has been designed to be the most comfortable decompression and laser that you'll ever experience. I mean, it is the only one that does robotic laser and decompression together, but we took very many great steps to make sure that it would be comfortable for you as well. So steps in the design and steps in the delivery of the treatment that make sure it's comfortable. So you should not really experience any pain during treatment. Most patients actually fall asleep. And that's important too, because everybody deserves a good nap. Thanks for watching, and we look forward to seeing you on some future videos. Points to remember. Relax, you're in great hands. You're about to experience the most effective non-surgical treatment available for back, neck, hip, and knee pain. Spine specialist robotic laser enhanced spinal decompression. Now, the most important factor to achieving great results is keeping your recommended schedule of appointments. In fact, it is associated with a 36% higher chance of success. Congratulations on beginning your journey to a pain-free life. We cannot wait to hear your healing story.